Hi everybody, I'm Dr. Joseph Cipriano, and today we have our patient. Now she is currently a med student in school, so you got to realize that she's constantly studying, constantly basically head in a book, neck down, looking down. So already right from the get-go, I would have already imagined some type of neck and shoulder pain. And what's kind of going on today?
Yeah, so like throughout the week, eventually kind of like I feel like pressure builds up over the week, and towards the end of the week I'm just kind of like forcing myself to like sit straight because I'm just so tight up there. And so yeah, I have some pain eventually, like towards the end of the week. It kind of just like builds up.
Okay, and then throughout the rest of the body, mid back, lower back, how's that feeling for
you? Usually that's okay.
Okay.
Usually focus on the upper
neck and then upper back, kind of following the trap muscle.
Yeah, exactly.
Okay. Alright, so what we're going to be doing today and what we're really going to be focusing on, yes, is right in through here, through the neck, through that trap, kind of going down. So what we are going to do today, I'm going to have you lay face down for me. Now, how I start every adjustment, I'm literally looking for symmetry from the right side to the left side, and we're going to compare. I'm going to feel for any tight muscles, any taut, tender fibers, anything, you know, if she does notice any pain anywhere, you know, those are also indicators of where there can be a nerve irritation. Okay, so let me know if anything that I do, if you feel any pain, anything like that, okay?
Okay.
So when I'm feeling her neck right now, the right side of her neck actually feels a little bit tighter than the left. So little things like this are what I notice. You know, we're going to take a look at her shoulders. Her left shoulder seems up higher compared to the right. And then you can definitely feel the tightness in the traps right through here and here. You notice that when I push in there?
Oh yeah,
okay.
It's painful.
Yeah, and I mean, I'm not, you know, it's not like I'm like digging in there.
Yeah,
I'm not pushing that hard. Okay. So yeah, in the cervical spine, we're noticing that right side, like I said, then we drop into the thoracic. Yeah, just tightness bilaterally going out, but I am noticing that shoulder height differential. So we're gonna follow the spine going all the way down. So in here, what I'm noticing is I'm actually noticing a rotation of the spine, where the spinous process are actually being rotated more towards the left side here. So as I'm pushing in, yeah, right on, like on this side right through here is what I'm noticing. So just some rotational components in the spine here. So we're going through that mid back, and now we're coming into that lumbar spine. So now her chief complaint and main pain is all right up here and then through the neck. So that is our main focus, which we do want to relax those muscles before we go ahead and make the adjustment today. Okay, any pain in that low back here? Okay. Any pain over the right SI joint when I push down?
No.
Directly over the sacrum? Or the left side?
No.
Okay, good. So no issues really in that low back, in the lumbar spine or the sacrum. So what we're going to do, we're going to come down and we're going to check the leg length out. So actually, well, it's a little short, just a little bit on that right side. It's not much. I mean, even when I'm pushing in, yeah, just a little bit. And actually, so when I scan up the body here, everything is looking pretty level through the hips. The only thing that I'm noticing is just how her scapula are actually portrayed down from the right one to the left one. So this is the only thing in that, you know, that I did notice, that shoulder height differential. So it, just as she's complaining of the little bit of pain and tightness in through here, that's exactly what we're finding as well. So what we're going to do, we're going to start off with the adjustment. I like to start the adjustments in that T1 region, and then we'll make our way down through here. Okay. First, so that everything is a little tight, I'm going to use the hypervolt. I just want to relax this area, just so we can, one, it's easier for me to make the adjustment, but then also I want your body to be able to hold the adjustment longer. Yeah, so what this is doing, we're just going to try to help relax some of the muscles in the area here, just because it is kind of following, you know, the trap muscles bilaterally. So we're going to go on either side And really just try to relax these areas out, make it easier to adjust. How's that feel when I do this?
Feels really like a pressure's being released, honestly.
Good. There we go. Perfect. Okay, so now, yeah, that definitely starting to feel a little bit better. Things are starting to just release and just kind of the tension drops down just a little bit, which is a good thing. So now we're gonna go ahead and we're gonna start the adjustment here. Okay. So we're gonna start off with that T1 on the left side here. Good. That just opened everything up right through that side. Now we're gonna drop down on the T2 on the right here. Good. Perfect. That just released also very well too. You notice a difference with that?
I do. It's like breathing easier.
Okay. So we're gonna go through the thoracic spine here. What I'm gonna have you do, I want you to take a deep breath in, exhale all the way out. There we go. We're gonna drop a little bit down. One more time, deep breath in, and exhale out. Good. Perfect. So just with that little bit of movement, I want to come down here. I want to recheck the legs. So, and it's still, I mean, to be honest, it's almost perfect even just with that. Just a little bit. This foot here wants to kind of roll in, so I do want to check some leg pulls here, just in that ankle, the knees, and also the hip. But besides that, I mean, she is pretty darn balanced, which is a good thing. I do want to check, see any stabilization issues in the sacrum area, just in case. So what I'm going to do, I'm going to put pressure down here. I want you to raise one leg at a time, so I want you to raise your leg up from there, as high as you can. Any pain, tenderness, tightness?
No.
All right, relax that side, raise this leg up. Any pain, tenderness, tightness?
No.
Do you notice a difference with raising up either leg?
I feel like it's harder to do this one.
Okay, so it's a little bit harder for her to do this one, and actually, if you guys saw when she was raising them up, this left leg actually did go up higher than the right side. So what we're gonna do, we're gonna do some drops on the sacrum, just so we can get that sacrum more towards midline. So the table's gonna just drop, just like that below you. What I'm gonna have you do, I want you to cross this foot, yep, just like that, perfect. So what's happening is her sacrum is pointing a little bit more towards that left leg, which is allowing that left leg to raise up higher. So what we're gonna do, we're gonna do a P to A drop, and we're gonna do a torquing motion. We're gonna be doing a counterclockwise torque, so we can get the midline of that apex of the sacrum directly down midline. Good. Uncross. Bend this knee for me. Leg length still looking good. Alright, I want you to raise this right leg up again. Do you notice a difference now?
A little bit, yeah.
Now, you may not feel it as much, but raise that right leg up again. I know on camera, everyone at home will definitely notice a difference from where it was before to where it is now. Yeah, that moved actually quite a bit. Okay. So now that that's aligned, we have that upper back area is all aligned. What I want to do is I'm going to have you stand up, just because I want to help clear out the rest of that thoracic spine here. So I'm going to have you stand right here in front of me.
Okay.
Arms out by your side. I want you to put your hands up and over line. Yep. And I'm going to lean you back on the knee and then squeeze your elbows together. Woo! And you felt how that just released all the way up there? Okay.
That was a few of them.
Alright, I'm going to have you take a seat right here for me. Good. So let's just check in that neck. So originally, I know you were feeling a little bit of tightness on that one side, which I'm actually not really even feeling it anymore. How's your neck feeling now?
I mean, I would usually complain right there. Really.
Yeah, no, it's... Yeah, that...
Dang.
Just that little bit of adjustments right in the beginning really helped with that. Okay. Yeah, so I'm not even finding any rotational component. So what we're going to do, we're going to do the Y-strap. What that's going to do, so it's going to pull the vertebra apart, starting from at that base of the occiput, going all the way down to that low back. So in your case, that your issues were just mainly through here. There's going to be a light distraction when I go to do it, but you'll feel how it removes pressure off the nerves that, you know, how the nerves exit, you know, the spine. So you'll feel how the vertebrae are going to pull apart, and you'll feel like release of pressure off nerves. And it literally, like, it's something you just got to experience. So I know this is going to be the first time with the Y-strap.
Definitely.
So I am just going to need your help to pull your hair through. Perfect. And I'm going to have you lean back. Keep your knees just how they are, bent off the table. Yep, just like that. Okay. So I stand up here at that top of the table. And yeah, you're perfect just like that. Now, what did you feel with that?
Definitely through my upper spine.
So I went very light, just because that I know that I really only had to reach right through here.
Yeah, that's exactly where it stopped.
Okay, perfect. So now, typically at times when I do have, you know, a more petite patient, if needed to be, you could always have somebody hold down on her knees. As you guys could tell, right when I did that pull, you seen all that I needed to get done and get that decompression on, it decompressed. The rest, you know, we just kind of pulled her entire body up. So, you know, one, we're not going to damage anything. There's not going to be any, you know, too much movement. But yeah, in your case, you felt that exactly where you needed that decompression.
Yep.
How would you describe that to somebody?
I think it's like honestly, it's like the cherry on top. It's like like you didn't think you need it, but after that, I mean, the fact that I can turn my head and not feel a difference between my neck, the sides of my neck, it's just like, it's almost like an instant release of pressure, and yeah, cherry on top.
So now we can get you, you know, back to school studying, being, you know, on your game, and
better posture.
Yep. And then eventually be saving lives, you know, especially in that emergency medicine when people need it. You know, that's how I look at, you know, when you need a medical doctor is really, you know, especially that emergency medicine, the accidents, things like that. Or then also, you know, your any type of, you know, like specific issues, you know, your cancers, your tumor, things like that, more specific.
Yeah.
Whereas your general, you know, a lot of times so many people that, you know, they go to, you know, doctors for pain pills and things like that. And I'm not saying that I'm against any of that, but how I look at it, especially as a chiropractor, I feel that all people should, and even with insurances, granted I don't take insurance for kind of this reason, but every person should first go through chiropractic care and physical therapy with any type of musculoskeletal disorder before they should get put on any type of pain medication, because I mean with the increased opioid addictions and like there's just so much going on where a lot of the times it's simply just a misalignment, or you know, maybe it's a muscle pulling too much. But if people don't try that route first, then all they go to is, you know, to just take that pill, you know,
that step could have been avoided.
Correct.
Just by going through certain things like this.
Yeah, so a lot of the times, you know, this is, you know, definitely a route that I suggest every person to go to firsthand, but
yeah.
Perfect. How you feeling?
I'm feeling great. Ready to start the day.
Good, good. All right, well, I'm Dr. Joseph Cipriano. If anyone is looking to schedule an appointment, just go right to my website, www.drjosephcipriano.com. Right from there, just, you know, request an appointment, and we'll get back to you, schedule you in, and love to see you. Have a good one, everybody.